well-known and one of the important oncologists, not only in Slovakia but also in the world. Founder of Onkoinfo, Dr. Stefan Korec. Stefan headed the National Oncology Institute in Bratislava, and he founded and successfully ran an oncology center in the state of New Mexico, USA. We are honored that Stefan accepted our invitation today. Hi, Stefan.
Thank you for having me. I'm glad to be here.
Stefan, can you compare the healthcare system in America and Central Europe? Where do you see the biggest differences when it comes to the innovative healthcare solutions?
Before I start, right at the beginning, I have to state that American healthcare system and Slovak healthcare system are at two ends of the broad, very wide spectrum of expenses. While United States is out of the average, really out of the box, spending more than $10,000 per person per year, Slovakia is on the other end of the spectrum, spending about $1,000 per person a year. So it's very difficult to compare systems that are funded with such a different amounts. But yes, in the United States, the patient means number one for the physician, an honor, and brings more money to the office. The patient in Slovakia is additional trouble, and one patient on top of 20 or how many the physician has already seen. So here is the reward, patient is coming. Here is the burden, the patient is coming, God, additional problems. And that's where it starts. Of course, our physicians are real physicians, they are trying to do the best. But roughly 80 to 90% of our physicians tell me here in Slovakia, I'm overloaded, I know I cannot give the patient as much time and as much attention as I would like to, but that's what I have to do. I have to see these patients. In the US, you have your schedule and you can say, fine, I'm going to see my 15 patients or 20 patients a day, period. Only emergencies. Here, they see 20, 30, 40 patients a day, which is twice, 3 times as many. How can you give them so much attention and so much time? So these are the main differences. Money, time, overworked physicians, and better organized system in the US.
And which countries have the best healthcare system, and where do you see their advantage?
It's very difficult, which is the best one. There are several countries which have good healthcare system. What comes to my mind is Netherlands, where the healthcare system is A, not overly expensive, B, provides the patients with the basic need and highly specialized need, and the population is very pleased and very happy with the services. 90% of population in Netherlands is happy and highly satisfied with the healthcare they have. I would say probably 80% of our population is unhappy, if it's not more, with our healthcare system. Same in Scandinavia, Canada, United States, although it's extremely expensive, and maybe because it's extremely expensive, provides extreme top-notch services, but it's expensive. People are complaining. It costs them money, deductibles, co-pays. So the population is not as satisfied in the United States as here in, I mentioned, Netherlands or Finland or Denmark.
Do you think that underfinancing of healthcare system of some of the European countries is the single biggest reason for the lower healthcare standard?
Underfinancing is one of the principal problems, but it's not the only problem. I'm again going to talk mostly about our system here in Slovakia, where we have many times duplicities, which means patient is getting additional CT even if it's not necessary. The scheduling is not according to the basic rules. There is, on one hand, a lack of appropriate or necessary medication. On the other side, it's wasteful use of medication, plus the daily visits or regular visits to physicians here in Slovakia are sometimes twice or three times as high as physician visits in the other developed countries. So it's several factors play a role, but yes, underfinancing is the principal cause.
Do you believe that artificial intelligence could fix healthcare in a meaningful and positive way, and at the same time can be still human?
Artificial intelligence is the melody of the day. It's highly popular. Is the topic every intelligent physician talks about. Yes, it is going to be helpful. It is already helpful in several areas. No, it's not the panacea for everything. It will not solve all the problems. It will not replace physicians. We say artificial intelligence is going to help physicians. It's the AI, artificial intelligence, augmented physician's performance, which means if a physician is able to read, let's say, 60 CT scans a day with the appropriate software with artificial intelligence, he can read 600. But in the end, he is the one who signs the final results. So it just augments his performance, but he is the one who is responsible. He is the one who needs to differentiate between suspicious and not suspicious. Sorry. And he is the one who will make the final decisions. Same artificial intelligence, let's see, reading pathology slides. Artificial intelligence can say yes, normal, not normal. Artificial intelligence is able to read slides and tissue samples probably more precisely, but in the end, it's still the physician who is responsible. So the answer, do you think it's going to solve the problems? No. Do you think it's going to help? Definitely, and this is the way to go, period.
Yeah, you're right. Is it rather the private sector that should overtake responsibility for the delivering innovative care for disease when the government is too weak?
It's both. Somebody has to break the ice, somebody has to take the risk, and somebody has to be the trailblazer who will show the way. The government, on the other hand, needs to be able, needs to understand this is the right way, this is the trend to follow, and apply the new trends on the wider scale. So yes, definitely, I think private industry is the first avant-garde to march. But yes, definitely government needs to be there and participate in the game. So both. I'm sorry, I cannot be just equal, but yes, that's how it is.
Healthcare and particularly pharmaceutical industry has been targeted by many people spreading hoax, for example, about America's cancer pill or international harmful vaccination. Is this problem getting worse worldwide, or it's predominantly in America?
It used to be years back. But right now, it's hard to tell if it's more predominant here in Europe or in the United States. Everywhere where people have access to internet, where people have access to 24-hour news cycle, and unfortunately, it's a very harmful occurrence that can mislead the patients, that can mislead the population, and can lead even to application of wrong treatment, and which may result in the death of the patient.
You are a pioneering person when it comes to the oncology research and to work with the oncologic patients, your whole care. Do you see some serious threats to cancer patients during the COVID-19 pandemic?
Unfortunately, yes. In the United States, they say that it's tens of thousands of patients, of cancer patients, whose surgery was delayed since it was not considered an emergency surgery. Therefore, they had to wait more because hospitals were closed just for emergency, absolute urgent care. And of course, cancer patient got delayed. Unfortunately, the numbers about the situation here in our country are not available, but I'm sure the same situation must be here since we also went through a lockdown and actually more serious and more stringent lockdown than in the US. So yes, it does interfere with cancer care, not only with the surgery, even chemotherapy was delayed, surgery was delayed, and unfortunately, which it will mean in the end, treating of more advanced cases with less promising results.
When it comes to the cancer gene therapy, we can see medialized cases when one single treatment costs several hundreds of or thousand euros per patient. Will the astronomical cost hinder its implementation into the standard healthcare in the near future?
Again, where does the price go in the near future?
Yes, basically, will the astronomical cost hinder its implementation into the standards healthcare even in the future?
The discussion was here 10 years ago, 20 years ago, and will be here 10 years from now. What is the appropriate price for the new medication? Unfortunately, the price will go up. It will go up because the indications, especially in oncology, will be narrower and narrower thanks to personalized medicine. Therefore, the expenses what the pharmaceutical company spends for the research will be more difficult to recoup, and therefore they have to go up with the price. The question, however, is what is moral, how high you can go, and how much the society can bear. I think United States is already reaching the max, spending about 17% of GDP on healthcare, while we are spending about 5.5%, so we still have reserves. And the expectation is that they reach in the future some kind of semi-plateau or plateauing in the prices of even the most expensive medication.
Improving the healthcare system in a country is never an action of a single man or women. What kind of people must pull the same strings to really create a significant change?
It has to start from the education, even from the selection of candidates for medical school. There are progressive schools in the US who are not selecting just the straight A students. You have to have the other qualities. That's one. Two, it has to take a close cooperation between medical profession, economists, and high-tech industry to come up with the joint solution. No single person can be important, but no single person cannot solve it. It's not even in the hands of physicians or economists. It has to be physicians, economists, and of course I missed the most important player are the patients or citizens before they become patients. Because if you take good care of your health, that's called health care. What we are providing here is sick care, taking care of the sick people. And we know we can reduce the incidence of majority of the disease by changing our lifestyle, by the way we behave, by our own contribution, which would reduce the expenses right at the start. And then comes the medical care itself, then comes the economy, pharmaceutical industry, but it has to be in balance.
Thank you. Stefan, we are actually really curious. What are your plans in the near future, and what are you doing in these days in Slovakia?
We already touched the artificial intelligence, digitalization. I'm oncologist, and for a modern oncologist, it's clear the question is answered. We cannot achieve any success, we cannot make any progress without inclusion of artificial intelligence. We are switching to personalized medicine, we are switching to genomic analysis, we are switching to digitalized pathology reading, and putting all those together, the tremendous amount of data. It's impossible right now with human brain only, without help of artificial intelligence. The tall gray-haired physician with rounded glasses who knew everything, it's the image of the past. Today's physician has to rely on data, has to be oriented in information technology, and has to rely on artificial intelligence. So when you ask, what is my next project? Hopefully implement as much as possible of digitalization and artificial intelligence into oncology care, from the primary care physicians to early diagnosis, to personalized medicine, through digitalized archiving, digitalized pathology slides, to, of course, artificial intelligence reading, genomic analysis, and finally coming to personalized medicine. The whole project could significantly reduce the mortality of our cancer patients, could even save money because we narrow down the treatment, we pay for the treatment that works, and won't pay for the treatment that does not work, eliminate the mistakes. We know that, for instance, reading pathology slides, physicians, 100 physicians putting together reading the slides, had up to 5% discrepancy in the results, while the machine has 0.5. Because machine cannot read anything else. Once it's well taught and well trained, it has much less room to make mistakes. So less mistakes, faster interpretation, and hopefully better patient care.
You are right, it's an amazing project you are working on right now. Do you have any final message for our virtual attendees when it comes to the improvement of the healthcare system in the country? Can we somehow help you in this amazing project you are working on right now?
Yes, thank you. This is actually one of the reasons I agreed to today's discussion, and we need help. Most of the people involved in the projects are physicians, so there are some economists, and we don't have enough IT people, we don't have enough people skilled in application of artificial intelligence. We need help in the digitalization of pathology images. We need help in the reading of CT, MRI results. We need lots of help exactly from people, hopefully, who are listening to us. Please contact us, please help, because your help can mean saving more lives. Please help. Thank you very much.
Thank you so much for being with us today. I hope that we will see each other in October on our hybrid event, 1920s, and you will tell us more about where you are with this project, and we can somehow move it forward. Let's stay with us, and I'm now giving the words to my colleague Thomas.
And thank you for the invitation.
Thank you.
It was an honor for me, and thank you. I hope we'll work together closely. Thank you.